So, Dr. Washington, we've received a lot of information lately about men's health. In particular, we've been seeing a lot more about things like erectile dysfunction. A once taboo topic has now actually become a lot more open, and we've noticed that a lot of people are actually talking about it. This is something that's come up quite a bit. And since you're doing a lot of traffic in this area too, I thought that maybe you could come in and help talk to us a little bit about what are some of the causes of issues such as erectile dysfunction for men, so that we can kind of address some of the issues and maybe reach out to those men that haven't asked the question yet and show them that it's not really a taboo subject anymore. It's a lot more out in the open.
Yes, well, I'm glad you brought up the fact that men are less reluctant to discuss sexual health, is what it boils down to. There's been a lot of coverage of this topic, and people are becoming more and more aware, not only of the disease of erectile dysfunction, but some of the precursors that can set you up for sexual problems. We do know that, for instance, that 50% of men by the time they're 50 are gonna have some type of problem, but you can get ahead of this by understanding the signs and symptoms and what to look for. And then of course know that treatment is out there when you do feel ready to address the situation in your life. As you mentioned, there are well-regarded environmental factors that can lead to sexual dysfunction. We know, for instance, anything that can affect your male hormones or actually your female hormone, for instance, estrogen, or the balance between the two can affect your sex life. So anything that affects these hormones, such as steroids in the foods, pesticides dealing with your foods, radio frequency involving your phones, poor sleep, stress. A lot of these things that we don't normally think about can be affecting our sex life. Unless you've actually had your hormones checked, you really don't know for certain where you stand along those lines. A lot of men can go with very poor hormone balance and having suboptimal hormones to a certain extent, and then all it takes is a mishap or two to get you off your game. And until you address the hormonal situation, you're going to continue to have difficulties in that area.
We've seen questions from people that are talking about the difference between psychological causes and like what you went over, which is a lot of physical or other situations. Can you talk a little bit about like psychological approach to ED?
Well, I'm glad you brought that up, because even though hormonal health is important, and I think a lot of people see erectile dysfunction as sort of a canary in the coal mine to address maybe underlying physical problems that may be getting missed, most oftenly it's a psychological issue. In other words, most of our men are otherwise healthy and have the mechanics that would be necessary for sexual activity. The majority of them are suffering from a psychological component. And I would say 90% of most of our men that appear at our clinic have a psychological component to a condition. All that means is that at some point in time, and oftentimes you don't find out why, but you got off your game, okay? And the subconscious mind has a way of picking up on this issue, and it doesn't let go. And so every time you go to, be in a sexual situation and the stage is set for you to perform, your subconscious mind is picking up on that. And the subconscious mind, of course, is very black and white, and it either understands success or lack of success. And so if you feed it success, that question mark that's in the back of your mind gets smaller and smaller, and our job is to make it go away. So our job is to treat the psychological component by giving you results. And that's what our focus is. We're focused on giving you results. We know that if we can give you results over time, you will get back to your baseline or even better than where you were before.
That's great. Now, one of the things that I also know is that a lot of men are also, we tend to be proud and the last ones to take care of things. Now, even though that has kind of died down and we're finding that men are more proactive in their health, as you mentioned, when is it a good time to see a doctor? What are some of the things that kind of come out, and why should you, take this seriously?
Well, preventative health is the key. A lot of men will wait until they can either not get the erection or they cannot keep the erection. I would say, even though we can treat those, we have a very high success rate, over a 98% success rate at treating erectile dysfunction is the total gamut. The time to be concerned is before it gets to that point, is to look out for the signs and symptoms that may give you insight to maybe hormonal problems. For instance, poor sleep, feeling fatigue, not getting the type of results in terms of your workouts, in terms of muscle mass and fat reduction. Obesity in general is a harbinger of underlying hormonal issues. Poor sex drive. Mental health and testosterone go hand in hand with men. So if you're, 30s or above and start having anxiety, start having depression, you need to be thinking, I need to find a doctor who can not only determine whether my hormones are low, but whether they're suboptimal or imbalanced, and is prepared to intervene and show you how to improve that aspect of your life.
That's great. So we don't really have to kind of acquiesce to just getting older and write it off. We could actually make changes and
Absolutely.
be active.
You
I
can
like
definitely
that.
intervene.
Yeah, I like that.